Yeah, thanks, Ryan. Yeah. Now, can dropping weight really be as easy as taking a pill? Well, the makers of a new prescription drug sure hope so. It's called Belviq and was just approved by the FDA this week. So what can you expect to lose? Okay, well, let's take a look at our associate producer, Lynette. Here she is now. Lynette is in the process of losing weight. She's already dropped 40 pounds. Well done, Lynette. But what would she look like if she started taking Belviq? Well, according to the makers, folks who took the pill lost nearly 4% of their body weight. So this is what Lynette would look like if she lost that much. But here's where it really starts to get interesting, because some people lost more. We're talking up to 5%. And here's what Lynette would look like if she lost 5% of her body weight. You see the difference. It is considerable. Keep in mind the people who took Belviq still had to diet and exercise. Don't think that's out the window. But as we know, most people who on diets fall off the wagon, so to speak, when the diet is over and gain back what they lost, in some cases even gaining more. So here's the thing, is this really a magic pill, or are you better off with old-fashioned diet and exercise? Joining me now, Dr. Anthony Youn, to answer some of these questions. Great to have you with us. Let me start by asking you, how does this pill work? What can you tell us?
Well, this pill actually works by affecting the serotonin receptors in the brain. And simply put, it causes your brain to think that you are full before you otherwise would. So it causes a satiation or a feeling that you're full after eating less food than you normally would. So resulting in basically less calories in and weight loss.
So folks at home see us having this conversation and they're thinking, am I a good candidate for this? I mean, who is this good for?
Well, it's good for people technically who are either obese, clinically obese, that's 1/3 of the population, or people who are considered just plain overweight, which is another third of the population, but also have some type of a medical condition that's related to their being overweight. So high blood pressure, high cholesterol, or type 2 diabetes. So these are the two groups that are considered recommended patients to take this medication.
And what about side effects? What about the risks associated with this?
Well, this drug has been in the pipeline for quite a while because there was an old drug called fen-phen that caused issues with heart valves. This drug was actually turned down by the FDA in 2010 because there was concerns about this. Well, it turns out that the risks of heart valve issues appear to be zero if it's taken in the recommended dose, and people can get a good amount of weight loss. You had mentioned earlier 5% after 1 year. I mean, it's not a magic pill. This isn't the answer to all people who are overweight's dreams, but it's a definite, it has its place between diet and exercise, which is the best way to lose weight, and surgery, which can be very effective, but obviously a surgery.
And what are we looking at in terms of cost for this? What are you hearing?
Well, we're not hearing a whole lot yet because it's probably about 4 to 6 months until it's going to be released. The interesting thing is one of the people who is a executive of the company actually stated that this is going to be about the cost of a Starbucks venti latte per pill. So it's not that expensive, hopefully, but once again, about 4 to 6 months before we see it on the market. And it's a really exciting development.
And just remind me again, in terms of when you think people will be able to get their hands on this?
About 4 to 6 months from now is when you can start the weight loss. Once again, it's something that we're excited about, but it's not something where you're going to lose 50 pounds over 2 months or anything like that.
All right, Dr. Anthony Youn, some great insight into this new drug that many people are talking about. We really appreciate your time tonight. Thank you.
Thank you very much.